This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning. Hi, it's Heiko from the Acupuncture and Air Show. Every Tuesday on Radio Kidnappers at 11 o'clock, I interview acupuncturists from around the world, but particularly New Zealand. Today we're going to be talking with Andrew Fraser again. We've spoken to him already on the show about classical Japanese acupuncture. And today we're going to be talking to him about lung health. And of course it's on everybody's tongue at the moment, everything to do with the immune system and lung, and everyone's worried about COVID and catching pneumonia and things like this. But, we know that Chinese medicine and acupuncture, can treat gallbladder and liver and thing, but particularly the lungs. But, Andrew, first sort of tell us what type of lung conditions do you commonly see in the clinic?
I would say common lung conditions that we see in the clinic could range from asthma to general breathing difficulties. Colds and flus are very commonly seen in the clinic, and that's all I can think of.
What about some people have wheezing, not necessarily asthma?
Wheezing, coughing. Lungs can be also associated with sweating patterns as well. Yeah.
And also, I know my own practice, I have a number of patients who just have phlegm. They don't actually have wheezing or asthma, but they just have ongoing phlegm. And do you find as well that that's something that you might see? Yeah, that could be
phlegm accumulating in the lungs from other systems. The lungs often catch the phlegm.
Yeah, and I know that with my patients that come in and they have lung problems, and they've usually done the rounds with the doctors and the specialists, and they've had a vague diagnosis that it's viral or maybe bacterial or maybe allergic or maybe constitution or maybe we don't know. But what about for you? How do you sort of explain most of the or some of the lung conditions from a particular a classical diagnostic point of view?
From a classical view, we could look at, first of all, a constitutional makeup of what the lungs involve. We see different constitutions amongst, for example, different races. So the Pakeha being predominantly white-skinned, we see that the Pakeha can be quite prone to lung conditions and lung diseases compared to some other coloured skin, for example. It depends. Yeah, you can heat in the lungs. That can be one problem. You can have lung deficiency, so not enough energy going to the lung.
Yeah, that's something that I was going to bring up because I know we talk about excess lungs and deficient lungs. Can you just give us because in Western medicine there's no such thing. It's like it's lungs or it's lungs. But
yeah, in a way you could say in a deficient situation there's not enough energy or nutrition getting to the lungs. Mm-hmm. And the opposite is the excess, where there's too much heat going to the lungs. Like with a bad flu, you feel hot in the lungs and hot in the upper chest. Yeah. And typically, that you could say that's an excess or a heat condition. They're two simple sort of sides of the coin of what can happen in the lungs.
And the other thing that when I talk to patients is that the lungs have this sort of dual relationship with the large intestine, and of course in modern medicine, there's no connection, but in traditional diagnosis, there is. Yeah. So, can we get problems with the large intestine as well as the lungs? Are they sort of like related?
Yeah, I can give you a quick example. Sometimes you can see a problem such as, let's say, hemorrhoids.
Yep.
And this is not always the case, but if there's a lot of heat entering into the lungs, the lung likes to push that heat away because it can't handle it.
Yep.
So the first place it's going to push it into is the large intestine meridian.
Yep.
And if enough heat goes into that meridian, it will actually push it into its own organ, which is the large intestine organ. So we may treat hemorrhoids, for example,
because that's the heat trying to come out, more or less. Yeah.
So we might use lung 6, for example, to treat that heat in the large intestine.
Yeah. You know, and I know some people listening now or watching the YouTube, they're going to be worried. Are we going to be sticking needles into the lungs, like into the chest or into the back?
We'll leave that for the physiotherapist, I think. No, generally, whenever I'm treating around, sometimes I use needles on the lung meridian, which runs up the arm, inside of the arm, up to the chest.
Yeah.
But sometimes we need to work around the chest, but generally I'm using very light needling, and I would say most of the time I'm not needling more than 1 or 2 millimetres under the skin.
Yeah.
That would be my maximum needling depth around the chest, so it's very safe, and the needles themselves are very thin, so they actually lie down, so there's no chance that there can be any puncturing occurring at all. Some acupuncturists like to needle deeply around the chest, but I very much prefer to keep it very shallow.
Yeah. Now, nowadays, of course, everyone is concerned about improving their health and getting a stronger internal health and a strong immune system so they can resist colds and flus. But what about with acupuncture? Can acupuncture sort of help this? You mentioned before in one of the other shows that even moxibustion can improve red and white blood cell count. But what about improving the immune system?
For sure. I think a little bit of a sticking point for some people is that they think of the lungs and colds and flus all around centering around the lungs, whereas the immune system is actually predominantly around the digestive system,
right,
and the state of the blood. So by improving your digestion, you're improving your immune system and therefore preventing colds and flus from happening. So the lungs are often almost like a secondary part of the equation, even though the symptoms occur there. So we really can use moxibustion. We've got a few little techniques where we burn very small particles of the moxa on the skin, which increases the red and white blood cell count of the body and therefore increases the immune response. I'll just continue. One interesting part is that the lung organ relates to the skin. So even simple things like skin brushing and stimulation of the skin itself will improve the lung function.
Yeah, and that's what I was going. My next point was, we talk about what's called the Wei Qi, or it loosely translates as like the protective energy. It's a bit like almost like a force field around the skin. Yeah. And you actually have, we have treatments to strengthen that. Can you maybe just elaborate how and what we would do there?
This maybe is getting a little bit technical, but we do see the Wei Qi as being on the very outside of the body and the skin and the body hair. Qi is obviously an invisible substance. We can tonify or strengthen that by very gentle techniques around the outside of the body. So a lot of classical tools, for example, we use to stimulate purely the outside of the body, and moxa can be, of course, which is one of the main ways that moxa works, is to stimulate the outside of the body, which actually stimulates the immune system and the lung and the Wei Qi. Yeah, so we could also call that Yang Qi. It's a very fine Qi, but it's like, you're right. It's like a force field around the body that keeps the bugs at bay.
Yeah, I think we're just getting a bit short on time now, Andrew, so we better finish up. But listen, thanks very much for coming on the show again for us, and perhaps next year we could get you back on again. And wish you success in Hamilton and Auckland, and when you go back to Japan again.
Sounds great.
And also, I just want to thank again Ken and Jill of the radio station for keeping this the cog in the machine going. And I managed to find a song that's sort of Japanese related, and it's a song called "Merry Christmas, Mr. Lawrence" by, pronunciation's not the best, but is it Ruchi Sakamoto? And here it is.
Yeah.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.